It is important to know if a cat is pregnant for several reasons. First, it allows the pet owner to provide appropriate care and nutrition for the expectant mother and her developing kittens. This includes making sure the mother cat has enough food and water, as well as a safe and comfortable place to give birth. Second, knowing if a cat is pregnant allows the owner to prepare for the arrival of the kittens. This includes making arrangements for their care and finding loving homes for them if the owner is not able to keep them. Third, knowing if a cat is pregnant can help prevent accidents or injuries that may occur during the birthing process. For example, if a cat is not observed closely and allowed to give birth in an unsafe area, it could lead to harm for both the mother cat and her kittens. Lastly, if a cat is pregnant, it is important to make sure that the cat receives proper prenatal care from a veterinarian. This includes vaccinations, deworming, and regular checkups to make sure that the cat and her kittens are healthy. Overall, knowing if a cat is pregnant is important for the health and well-being of both the mother cat and her kittens, as well as the owner's ability to provide proper care. Physical signs. One of the most obvious signs of a pregnant cat is a change in size and shape of the abdomen. As the kittens develop, the belly will become larger and rounder. This change in size will typically be noticeable around the 3rd or 4th week of pregnancy. Additionally, the cat's nipples may also enlarge and darken in color as the pregnancy progresses. As the kittens grow, the cat's belly will become more pronounced and may even appear to be taut. It's important to note that a change in size and shape of the abdomen alone may not be a definitive sign of pregnancy, as other factors such as weight gain or bloating can also cause a similar appearance. Therefore, it is important to observe other signs and symptoms of pregnancy, and if in doubt, consult a veterinarian for confirmation. Another sign of pregnancy in cats is the enlargement and darkening of the nipples. As the cat's body prepares for lactation, the nipples will become swollen and may appear pink or red in color. This change is typically noticeable around the 3rd or 4th week of pregnancy. It's important to note that not all cats will show visible changes in their nipples, and some cats may have only slight enlargement. Also, some non-pregnant cats may also show similar changes due to hormonal fluctuations, infection, or other underlying conditions. Therefore, it is important to observe other signs and symptoms of pregnancy, and if in doubt, consult a veterinarian for confirmation. It's also important to note that swollen nipples may indicate other conditions such as mammary tumors, so it is always best to consult with a veterinarian if you notice any changes in your cat's nipples. An increase in appetite is another common sign of pregnancy in cats. As the kittens grow, they will require more nutrients, which can lead to the mother cat feeling hungrier. Some cats may show a significant increase in appetite, while others may only eat slightly more than usual. It's important to note that an increase in appetite can be due to other conditions as well, such as worms, a thyroid problem, or dental issues. Therefore, it is important to observe other signs and symptoms of pregnancy and consult a veterinarian if you are unsure about the cause of your cat's increased appetite. It is also important to provide a balanced diet to pregnant cats as they have increased nutritional needs. A veterinarian can recommend a diet that will provide the necessary nutrients for the mother cat and her developing kittens. Lastly, it's important to monitor the cat's weight during pregnancy and adjust their food intake as needed to prevent excessive weight gain and obesity. As the due date for her kittens approaches, a pregnant cat may display nesting behavior. This can include seeking out secluded and cozy spots to rest, such as under a bed or in a closet, as well as gathering soft materials such as blankets or laundry to make a nest. This behavior is usually seen a week or 2 before giving birth, but it can vary depending on the cat. Some cats may start to display nesting behavior as early as a month before giving birth. It's important to note that nesting behavior is not unique to pregnant cats, and some cats may display this behavior due to stress, anxiety, or other underlying conditions. Therefore, it is important to observe other signs and symptoms of pregnancy, and if in doubt, consult a veterinarian for confirmation. It is also important to provide a safe and comfortable area for the cat to give birth, such as a clean and quiet room. This will help reduce stress and anxiety and make the birthing process smoother for the mother cat and her kittens. Behavioral signs. Hormonal changes during pregnancy can lead to fluctuations in a cat's mood, and as a result, they may display increased affection or aggression. Some cats may become more affectionate towards their owners, seeking out more petting, grooming, or cuddling. On the other hand, some cats may become more aggressive or irritable, especially if they feel threatened or uncomfortable. It's important to note that behavioral changes such as increased affection or aggression can also be caused by other factors such as stress, anxiety, or other underlying conditions. Therefore, it is important to observe other signs and symptoms of pregnancy and consult a veterinarian if you are unsure about the cause of the changes. It's also important to respect the cat's boundaries and give them space if they show signs of aggression or discomfort. During the pregnancy, it's important to create a peaceful and stress-free environment for the cat. This can include providing a comfortable and safe place for them to rest and avoiding loud or sudden noises. Lastly, providing plenty of affection, playtime, and positive reinforcement can help a cat feel more relaxed and comfortable during pregnancy. Changes in sleep patterns are another common behavioral sign of pregnancy in cats. Pregnant cats may sleep more or less than usual. This can be due to the physical and emotional changes that the cat is experiencing, as well as the need to conserve energy to support the developing kittens. A cat may sleep more during the early stages of pregnancy, but as the due date approaches, they may have trouble sleeping due to the discomfort of their growing belly, or due to anxiety about giving birth. Some cats may even experience insomnia, restlessness, or sleep disruptions. It's important to note that changes in sleep patterns can be caused by other conditions, such as stress, anxiety, or other underlying health issues. Therefore, it is important to observe other signs and symptoms of pregnancy and consult a veterinarian if you are unsure about the cause of the changes. It's also important to provide a comfortable and safe place for the cat to sleep, and avoid disturbing them during their sleep. Creating a peaceful and stress-free environment for the cat can also help them sleep better. Lastly, it's important to monitor the cat's overall health, and if you notice any unusual or persistent changes in their sleep patterns, it's best to consult a veterinarian. Increased vocalization is another behavioral sign of pregnancy in cats. Some cats may become more vocal during pregnancy, meowing more frequently or in different tones. This can be due to hormonal changes, physical discomfort, or anxiety. For example, a cat may meow more frequently to get the attention of their owner, or to express discomfort or pain. Some cats may also yell or make other vocalizations when they are in heat or nearing the end of their pregnancy. It's important to note that increased vocalization can be caused by other factors such as stress, anxiety, or underlying health issues. Therefore, it is important to observe other signs and symptoms of pregnancy and consult a veterinarian if you are unsure about the cause of the increased vocalization. It's also important to provide emotional support to the cat during pregnancy, such as spending more time with them, providing plenty of affection and playtime, and creating a peaceful and stress-free environment for them. Lastly, if the increased vocalization becomes excessive or persistent, it's best to consult a veterinarian as it could be an indication of a more serious issue. Hormonal changes that occurred during pregnancy can lead to behavioral shifts in cats. These changes can be caused by the increased levels of progesterone and estrogen, which can affect the cat's mood, activity levels, and behavior. For example, hormonal changes can lead to increased affection or aggression, changes in sleep patterns, increased vocalization, and nesting behavior. Hormonal changes can also lead to a change in the cat's grooming behavior, as well as their appetite. It's important to note that behavioral changes due to hormonal fluctuations can also be caused by other conditions such as stress, anxiety, or underlying health issues. Therefore, it is important to observe other signs and symptoms of pregnancy and consult a veterinarian if you are unsure about the cause of the changes. It's also important to provide emotional support to the cat during pregnancy, such as spending more time with them, providing plenty of affection and playtime, and creating a peaceful and stress-free environment for them. Lastly, it's important to monitor the cat's overall health, and if you notice any unusual or persistent changes in their behavior, it's best to consult a veterinarian as it could be an indication of a more serious issue. Medical confirmation. A veterinarian can confirm a cat's pregnancy through a physical examination or ultrasound. During a physical examination, the veterinarian will feel the cat's abdomen for the presence of fetuses and will also check for other signs of pregnancy such as changes in size and shape of the abdomen, swollen nipples, and nesting behavior. The veterinarian may also use a stethoscope to listen for fetal heartbeats. Ultrasound is another way to confirm pregnancy in cats. This is a non-invasive procedure that uses high-frequency sound waves to create images of the cat's uterus and fetuses. An ultrasound can detect pregnancy as early as 15 to 20 days after breeding. Blood tests can also be done to detect the presence of pregnancy-related hormones such as progesterone. This test can confirm pregnancy as early as 15 to 18 days after breeding. It's important to note that a veterinarian examination is the only way to confirm pregnancy, and if you suspect your cat is pregnant, it's best to schedule an appointment with a veterinarian as soon as possible. This will ensure that the cat receives proper prenatal care and that any potential issues are addressed in a timely manner. Yes, blood tests can also be done to detect the presence of pregnancy-related hormones such as progesterone. Progesterone is a hormone that is produced by the corpus luteum, an ovarian structure that forms after ovulation. The level of progesterone in a cat's blood increases during pregnancy and can be used to confirm pregnancy. A veterinarian will take a small blood sample from the cat and send it to a laboratory for analysis. The results of the test will indicate the level of progesterone in the cat's blood. A high level of progesterone is an indication of pregnancy, while a low level is an indication that the cat is not pregnant. It's important to note that blood tests can confirm pregnancy as early as 15 to 18 days after breeding, which is earlier than other methods such as physical examination or ultrasound. However, blood tests can be less reliable than other methods, as there can be variations in the results due to individual differences in the cat's hormone levels. It's also important to note that blood tests are not a substitute for a veterinarian examination, and it's best to consult a veterinarian for confirmation of pregnancy, as well as for proper prenatal care and monitoring of the cat's and kitten's health. By being aware of the physical and behavioral signs of pregnancy, as well as seeking confirmation from a veterinarian, pet owners can determine if their cat is pregnant. Physical signs of pregnancy in cats include changes in size and shape of the abdomen, swollen and pink nipples, increase in appetite and nesting behavior. Behavioral signs include increased affection or aggression, changes in sleep patterns, increased vocalization, and hormonal changes leading to behavioral shifts. A veterinarian can confirm a cat's pregnancy through a physical examination, ultrasound, or a blood test. A physical examination can detect pregnancy as early as 21 days after breeding, while ultrasound and blood tests can detect pregnancy as early as 15 to 18 days after breeding. It's important to keep in mind that not all cats will display all the signs of pregnancy, and some cats may show only slight changes. Therefore, if you suspect your cat is pregnant, it is best to consult a veterinarian for confirmation and proper prenatal care. By being aware of the signs of pregnancy and seeking confirmation from a veterinarian, pet owners can ensure that their cat and her developing kittens receive the proper care and attention they need.